Hi, good morning everyone. I'm going to be presenting the topic of social determinants of health, and I'm going to give a mental health perspective. Now, this is a topic. Um, this year, the Trinidad and Tobago Medical Association is so important, and actually this year, the World Medical Association President, Sir Michael Mammon, he had come to Trinidad and Tobago and did some work. I'd like to stop for a while to recognize the Minister of Health, the Honorable Mr. Terence Yeltsin. So just to remind ourselves about the definition of mental health is defined as a state of well-being, in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. Mental health is shaped by social, physical, economic, and environmental factors. A mental health disorder is a syndrome characterized by clinically significant disturbance in an individual's cognition, emotional regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. Mental disorders are usually associated with significant distress in social, occupational, or other important activities. The mental disorders we talk about include anxiety, depression, schizophrenia, alcohol, and drug dependency. Although common mental disorders can result from stressful experiences, some persons experience sub-threshold mental disorders, which means they experience poor mental health that does not reach the threshold for diagnosis as a mental disorder. From this map, we can see that higher income countries do a better job of documenting mental disorders. This table shows that in lower income countries, they actually have a lower number of providers, mental health providers per 100,000 people compared to higher income countries. So government spending on mental health in most of the relevant countries is far lower than is needed. The poorest countries spend the lowest percentages of their overall health budgets on mental health. Most care is now institutionally based, and the transition to community care would require additional funds that have not been made available in most countries. Human resources available for mental health care in most low-income and middle-income countries are very limited, and shortages are likely to persist. The main obstacles to better mental health in low-income and middle-income countries include scarcity of available resources, inequities in their distribution, and inefficiencies in their use. In middle and lower income countries, more research needs to be done to measure the problem. Strategies, policies, and programs need to be put in place to deal with and prevent mental disorder. The Commission on Social Determinants of Health was established by the WHO in March of 2005 to support countries and global health partners in addressing the social factors leading to ill health and health inequities. This was chaired by Professor Sir Michael Mammon with 18 other commissioners. So I'm going to present some of the main findings. In addressing issues relating to mental disorders, a life course approach is needed to improve conditions from before birth, during early childhood, school age, during the building of family life, at working age, and at old age. Action is needed to decrease the risk of mental disorders throughout the life course at an individual level, family level, community level, and country level. A systematic review of studies in low and middle income countries estimated prevalence of common perinatal mental disorders among women to be 16% before birth and 20% postnatally. Risk factors for common perinatal disorders include socioeconomic disadvantage, unintended pregnancy, being younger, being unmarried, lacking intimate partner empathy and support, having hostile in-laws, experiencing intimate partner violence. Yeah. A bad man.
That's a contributor to bad mental health. In-laws.
Yeah, if you have a bad man-in-law.
Good thing my mother-in-law loves me.
Having insufficient emotional and practical support, in some settings giving birth to a female infant, and having a history of mental health problems. Factors to reduce common perinatal disorders include more education, having a permanent job, being of the ethnic majority in some countries, having a kind, trustworthy, intimate partner. So in a study done in Pakistan, Rahman and colleagues estimated that by reducing maternal depression by 75% would result in reductions in child underweight by 36%. So the Institute of Health Equity conducted a recent review of literature on factors influencing early childhood and found that a lack of secure attachment, neglect, lack of quality stimulation, and family conflict negatively impact on the future social behavior, educational outcomes, employment status, and mental and physical health. So it has been found that family and parenting support, improvement in social and emotional interactions in maternal care and childcare, education, and wider family and strong community support are remedies for offsetting inequalities in early years. In Jamaica, an intervention aimed to improve child development through educating mothers about better child rearing practices and improving their self-esteem was done in several parishes. It involved community health workers from government health centers visiting homes on a weekly basis for half an hour to demonstrate activities usually like play activities, which involve the mother, the child, and the caregivers. The home visits also presented an opportunity to discuss parenting issues, including important nurturing skills, child nutrition, and how to promote good play and learning environments between health worker and mother. An analysis of the intervention suggests the home visits from community health workers significantly reduced maternal depression. Other interventions used in early childhood include the Triple P Positive Parenting Program, which is used in Australia, Hong Kong, Iran, and Switzerland. It is a behavioral family intervention that aims to improve child behavior and development by altering the family environment to one that enables the child to realize its potential. In the USA, they use a lot of preschool interventions, such as the High School Preschool Project, the Nurse Family Partnership, and the Incredible Years series. Action to support mental health in older children and adolescents tend to be implemented in the school setting. Schools play an integral role in nurturing development in terms of social, emotional, academic, and cognitive ability, the effects of which can influence children's short and long-term mental health. As children grow into adolescence, they become more interested in taking risks, including substance misuse. It is important to ensure that adolescents have the knowledge to make informed decisions and that they have protective factors including social and emotional support and positive interactions with peers, family, and the wider community. In a study done by Dr. Rohan Maharaj et al. In 2009, it was found that 24% of adolescents use cigarettes, 17% use marijuana. 19% less than 10 years old had already initiated sexual activity. And of those, 19% had 6 or more sexual partners. 20% of teens account for all pregnancies, and of those, 1/5 of those had a second pregnancy. 26% of teens of young adults between the ages of 18 to 21 had a sexually transmitted infection, the most common being gonorrhea and chlamydia. 9% had severe depression, 12% had already attempted suicide. 10% had a history of carrying a weapon to school in the last 30 days, and 5% almost always wanted to kill another person or injure someone. 11% were overweight, and 7% were obese. So it is important to inform and educate the family, youth, and general public about adolescent health and development issues. Monitor and assess adolescent health status to address their needs, do health promotion, prepare them for parenthood, such as sex education, do peer counseling, make available religious instruction, provide parental guidance, plan and advise for future employment, make opportunities for suitable continuing education, example via grants, loans, scholarships, etc. The Global Burden of Disease Project indicates there are significant and increasing levels of mental disorders among the global adult population. Among women, major depression is the leading cause of years lived with disability, while anxiety ranks 6th in the list. Among men, major depression ranks 2nd, drug use disorder ranked 7th, alcohol use disorder ranked 8th, and anxiety ranked 11th. An estimated 1 in 4 or 5 young people aged 12 to 24 will suffer from a mental health disorder in any 1 year. So actions to support mental health among adults include job security and a sense of control at the workplace. Employers therefore have a significant role in potentially reducing or exacerbating mental disorders among working age populations, and should institute better employment practices to ensure that a higher satisfaction at work and better working conditions are met, and that employee assistance programs offering psychological counseling and psychiatric referrals are available. The implementation of accessible financial services is essential to tackling poverty, empowering people, particularly women and communities, and reducing poor physical and mental health among the most disadvantaged. Microfinance programs help the poorest earn a living, improve their business, and provide a means for entire communities to work their way out of poverty. This has a direct benefit to physical health, interpersonal, familial, and wider social relations, as well as being likely to reduce downstream effects of violence, including anxiety and depression. Policies to reduce alcohol consumptions are important as well. In many countries across the world, alcohol consumption is negatively associated with population mental health, increasing the likelihood of alcoholism, depression and suicide, as well as other harmful outcomes, such as poor physical health, accidental injury, and domestic violence. In the Canadian province of British Columbia, minimum alcohol pricing has been implemented for the past 20 years, adjusting the price of alcohol incrementally over time in an attempt to reduce consumption. A longitudinal study analyzing data from 1989 to 2010 estimates that a 10% increase in the minimum price of alcoholic drink reduced consumption relative to other drinks by 16.1%, with consumption of all alcoholic drinks reduced by 3.4%. Good accessible maternal services, information and advice about parenting strategies, assistance to manage transitions to parenthood, support for parents to improve employment prospects, income and housing conditions also influence successful parenting and reduce mental disorders. In the elderly population, depression is one of the major mental health issues. And this is due to bereavement, perceived loss of status and identity, poor physical health, loss of contact with family and friends, lack of exercise, and living alone. So interventions to reduce social isolation, to promote lifelong learning, to reduce poverty, to improve physical health, to improve heating in the home, to help older people make new friends, to provide opportunities for older people to volunteer, can significantly reduce depressive symptoms. According to the Mental Health Atlas 2011, 60% of WHO member states have developed policies dedicated to addressing mental disorders, covering approximately 72% of the world's population, while 71% of countries have designed a mental health plan, and 59% have implemented mental health legislation. However, the gap in policy coverage between higher income and low income countries is significant. 92% of people living in high income countries are covered by mental health legislation, whereas only 36% of people living in low-income countries are covered. So in Trinidad and Tobago, we do have a mental health program. There are policies and plans and legislation. There's the mental health plan and emergency disaster preparedness plan for mental health in Trinidad and Tobago, which was done in 2000. And there's the Mental Health Act, which was last amended in 2014. All right? So as you can see, the social determinants of health, it affects our brains in many different ways, from gender violence to discrimination to poverty. So there's so many different factors that affect us and why we develop mental disorders. Right?